Hair. People are sometimes surprised to learn how much lifestyle history is held in our hair. Drugs get absorbed from the bloodstream into the root of the hair, and it takes about 5 days' growth to emerge above the scalp. Hair grows at an average of about 1 centimetre a month, so a 3 centimetre length of hair would give a drug history of about 3 months. The laboratory can analyse this in a single section, in which case we can say whether a person has used a particular drug in the last 3 months. Alternatively, it can be cut into 1 centimetre lengths, which might show more clearly when the drug was used, although hair testing cannot pinpoint an exact date when a drug was used. Its great value lies in showing that someone has not used a drug, for example, monitoring return to work. 3 important things to remember when collecting hair specimens. 1. You need to cut the hair as close to the scalp as possible. 2. The root end of the hair must be identified, otherwise the history of use will be back to front. The laboratory needs a minimum weight of hair for the analysis to be valid. To make sure you don't forget, the general rules for collecting specimens are repeated here. Always use your checklist. Make sure that you complete the paperwork and apply all specimen seals and barcodes as directed. Double-check the chain of custody form to make sure all sections are completed. The donor must give informed consent for the specimen to be analysed. Remember the principles that you have to follow. You are starting the chain of custody for the specimen and need to make sure that you can verify that it is a genuine specimen from a particular individual. Where the person has hair, this is not a problem, although hair extensions may be confusing. We will look at specific problems after showing how you take a specimen from someone with a reasonable head of hair. The collection area should be private, with space to set out your equipment and paperwork. For each individual collection, you need your collection checklist, donor information sheet, medication checklist, scissors, and an unopened collection kit. The chain of custody form for the specimen is in the kit package attached to the specimen bag. Getting ready. Make sure you have a clear table or surface and an upright chair next to it. You need your paperwork, your scissors, and at least 3 unopened kits. Make sure the surface you are using is clean and clear. If possible, use a tray or a sheet of plain paper to lay out the items. Specimen collection. Always greet the donor with a smile. Introduce yourself and show the donor your ID card. Then ask them to provide you with a copy of their own ID. Ask the donor to read the donor information sheet and then explain the use of the checklist. The donor must follow the checklist with you, so talk them through it, continually referring to the numbered steps, explaining what you are doing at each point. This will take you through the whole process in a logical way and will minimize the possibility of you making mistakes. Ask them for consent to take a specimen of hair for drugs testing. Invite them to select a kit, then remove the others, and work your way down the checklist, drawing the donor's attention to each point. For hair testing, we recommend that you do use the word suggested, as people are sensitive about their hair and worry about the consequences to their appearance. You have about 100,000 hairs growing on your head. I need to collect 2 specimens of about 50 to 100 hairs, which is about the thickness of a pencil lead and is usually unnoticeable. I will carefully take the specimens from the crown of the head, where the hair grows most quickly. Open the kit package, remove the gloves, sterile wipe, chain of custody form, and wax envelopes, and place these on your work surface. The plastic bag can be kept by the side and used as a rubbish bag. Put on the sterile gloves and explain that you are wearing gloves to avoid cross-contamination. Wipe the blades of the scissors with sterile wipe provided. Take the silver foil out of one of the wax envelopes and place on your sheet of paper on the table. Stand beside the donor. Carefully pick out a specimen of hair to cut. Twisting it lightly can help keep the strands together and straight when you cut the hair. Place the scissors flat to the donor's scalp. Cut the specimen as comfortably close to the scalp as possible, gripping the specimen with 2 fingers. Place the cut ends of the hair approximately 1.5 centimeters over the edge of the marked end of the silver foil. This is very important as it indicates to the lab which is the most recent growth. If the hair is very short, place the whole specimen into the middle of the foil. If the hair is long, wrap the loose ends around the bottom end of the foil and make sure you keep both ends separate from each other when you are placing the foil in the envelope. Place the foil in the wax envelope and seal the flap down. Repeat the process for the second specimen using the second foil and envelope. You can now take the gloves off and place them in your rubbish bag. Stick the bar-coded labels across the seal of the wax envelope. The bar-coded labels are tamper-evident, so peel them off carefully so that they do not tear. Ask the donor to initial the bar-coded labels. Place the wax envelopes in the clear bag. Remove the paper strip above it, turn the flap over and seal it to the bag. Place a barcode label across the flap and bag as indicated and ask the donor to initial the barcoded label. The specimen has now been sealed twice with tamper-evident barcoded labels. Then complete the chain of custody form, including the questions on hair colour, site and treatments, as well as medication. Complete the sections relating to the customer and tests following your instructions. Complete the collectors section of the form, then obtain the donor's signed consent to the specimens being sent for analysis. Check and double-check that you have completed the form. Remove the bottom copy of the chain of custody form. Fold the chain of custody form in half, enclosing the specimens, and place it in the pre-printed business reply envelope and seal it. Dispose of all used items in a rubbish bag that you will remove from site and prepare your area for the next collection. All remaining paperwork must be dealt with according to your instructions. We will now look at some of the problems you may encounter when people have difficult hairstyles, or no hair, or cultural issues with hair testing. Very short hair, for example 1 to 2 centimeters long. This length is still collectible as a specimen, but there may be a difficulty in cutting the hair without making a cosmetic difference. You can take smaller amounts of hair from 2 or 3 different places on the head to avoid cutting a large, visible hole in the hair, but always cut as close to the scalp as comfortably possible. With hair less than 2 centimeters long, don't place the cut ends over the marked edge of the foil. Simply drop the whole specimen into the center and fold the foil around it securely. Very short hair, number 1 or skinhead haircuts. Much less than 1 centimeter long and it becomes almost impossible to cut with the scissors. Therefore, you could suggest taking a specimen of body hair. This could be hair from a beard, underarm, chest or leg, but not pubic hair. Due to the skin being looser, there is a greater risk of injuring the donor when taking this kind of specimen. Therefore, great care should be exercised. You are still trying to collect 50 to 100 hairs for each specimen. As you may be asking the donor to remove some items of clothing, you should offer the donor the option of asking for a same-gender representative to witness the procedure. Rastafarian or braided hair. In these circumstances, a whole twisted, braided piece may need to be cut from the base, as it may be impossible to pick out 50 to 100 loose hairs. Place the entire length in the specimen envelope. If there is not enough room in the wax envelope, use the dispatch envelope instead, with the bar-coded label and donor's initials sealing it. Fold that in half and place it in another dispatch envelope, with another bar-coded label across the seal. Hair extensions. Hair extensions are becoming increasingly common, and the donor will often not alert you of their existence. Always be vigilant when choosing the hair specimen, and if you think they may be present, ask the donor to confirm this. Try to ensure you take the specimen from an area free of extensions. If this is not possible, inform the client that you are unable to take an acceptable specimen. Ethnic objections. As an example, the Sikh religion prohibits the cutting of any hair, and you may encounter other cultural standpoints, resulting in a refusal to provide a sample. You must be very careful to give them an unpressured opportunity to refuse to do so, without giving the impression that they are being difficult. If in doubt, simply decline to take the specimen. Sufficient specimen weight. This can be difficult to judge for hair specimens, particularly when the specimen is short hair or body hair, but we provide a visual guide to help you judge if you have collected enough.